Hello, everyone, and welcome to the final day of our 2020 Ashford Research Symposium. My name is Dr. Tim Rice, and I am the lead faculty member and program chair of the Doctor of Psychology program here at Ashford. I'm really excited to introduce you to Dr. Taffy Hawkins today, who's going to be presenting on her findings from her dissertation titled "The Perceptions of Coaches, Athletic Trainers, and Rehabilitation Professionals Concerning the Use of Mental Imagery Practice to Counter the Psychological Effects of Injury in Sport." Dr. Hawkins has a lot of experience not only in higher education as a faculty member, but has also been heavily involved in helping within research, and she's also done a lot of work in mental and physical strength training, if you will, and performance. So Dr. Hawkins, you're on right now.
Thank you for the introduction, Dr. Rice. This is the perception of coaches, athletic trainers, and rehabilitation professionals concerning the use of mental imagery practice to counter the psychological effects of injury in sport. And I'm Dr. Taffy Hawkins. I have 6 years experience conducting and assisting with health and psychology research, 12 years assisting amateur athletes of all ages to improve their physical and mental performance, 6 years teaching fitness, strength, and health policy courses for 3 colleges and universities, and I hold a bachelor's and master's of exercise science, as well as a doctorate in sport and performance psychology. Sport participation allows for the possibility of becoming injured, and the risk increases as the number of exposures increases. Physical injury is also associated with some degree of psychological symptoms, and imagery use has been studied to decrease these negative psychological effects associated with injury and improve performance, though more research is necessary to determine the perceptions and readiness of rehabilitation professionals to meet these needs. Research has shown that athletic trainers and rehabilitation professionals lack confidence in their ability to provide psychological intervention for athletes due to their lack of training and education. The perception of coaches and rehabilitation professionals was gathered to determine the need and desire for more structured education concerning the use of mental imagery for injured athletes. And this data was used to design a training manual for rehabilitation settings. Injury often accompanies participation in sport at most levels of play, yet traditional rehabilitation protocols do not address psychological symptoms of injury. Mental imagery has been shown to be an effective intervention to decrease the psychological symptoms of injury, and it's important to determine the attitudes of coaching and rehabilitation staff concerning the use of mental imagery training and their preparedness to offer this form of treatment in addition to physical rehabilitation. There exists a gap in research and understanding why coaches, athletic trainers, and rehabilitation professionals choose to incorporate mental imagery practice into rehabilitation, or why these psychological interventions may not be employed. This study allowed for greater understanding of the needs of these individuals to better address the psychological needs of their athletes. The information gathered from this study was considered and incorporated into a mental imagery training manual for use in rehabilitation settings, and the use of this manual could allow for better formalized training of mental imagery techniques and more confident implementation of psychological intervention in sport rehabilitation. The purpose of this study was to determine the perception of coaches, athletic trainers, and rehabilitation professionals concerning the use and effectiveness of mental imagery practice and rehabilitation to decrease pre-competition anxiety and fear of re-injury in injured athletes. To provide insight from coaching and rehabilitation personnel to evaluate their attitudes, preparedness, and utilization of mental imagery and rehabilitation, and to develop a manual that can better prepare individuals conducting rehabilitation to effectively address the psychological symptoms of injury with confidence. The theoretical framework for this study was Lazarus and Folkman's transactional model theory of stress and coping. And this theory included a model for how athletes would appraise the stress of their injury and determine which coping skills are present to negate the stressor. They might ask themselves, is it significant, stressful, or harmful? And do I possess the skills and resources to cope with this stressor? The study was designed as a qualitative case study to understand the needs, concerns, and perceptions of individuals working closely with injured athletes. A literature review on the subject was conducted to determine findings from previous studies, as well as the gap in research. While there's been some research of the perception and the development of the attitudes about imagery survey, there was not an in-depth discussion to determine how best to better prepare these individuals. In my study, I included an interview as well as the AAI and the Sport Imagery Ability Questionnaire to allow for a more comprehensive understanding of what the gap was in research and education and how the manual might address those needs and concerns. Participants were recruited through social media groups on Facebook, LinkedIn, and through snowball sampling methods, and personal email addresses were obtained by permission of the individuals and group administrators. I sent an email explaining the research study, and the participants were sent a link to the SurveyMonkey website through the email. A section denoting informed consent was completed prior to beginning any data collection. The Sport Imagery Ability Questionnaire and the Attitudes About Imagery survey were completed on the SurveyMonkey website. Interview participants were interviewed and recorded for 45 to 60 minutes using a script of 17 questions that I developed based on the research questions. And these were the research questions that guided the study. Question number 1, what are the perception of coaches, athletic trainers, and rehabilitation professionals concerning the effectiveness of mental imagery practice for injured athletes in sport rehabilitation programs? Question 2, how prepared athletic trainers and rehabilitation professionals feel based on their education and research and experience to administer psychological intervention as mental imagery in rehabilitation? And how can mental imagery education be enhanced to allow for athletic trainers, coaches, and rehabilitation professionals to feel better prepared to administer psychological intervention as mental imagery in rehabilitation? We had 8 interview participants, 3 males and 5 females, with a mean age of 39.625 years. This included 4 coaches, 1 athletic trainer, 2 physical therapists, and 1 rehabilitation professional, with years in the profession ranging from 2 to 27 years. There were 17 questions developed based on the gap in research noted in the literature on the topic of mental imagery and rehabilitation. These questions closely aligned with the research questions posed in the study and addressed demographic information and background, perception of coaches and rehabilitation professionals concerning the use of mental imagery, the preparation of these individuals to address psychological symptoms of injury and treat these symptoms, and how mental imagery education can be enhanced to allow for better recognition and treatment of the symptoms. There were 25 survey participants with a mean age of 41.176 years, 8 males and 9 females. This included 10 coaches, 1 athletic trainer, 4 physical therapists, and 2 that worked in the sport rehabilitation field, with 8 individuals choosing not to disclose demographic information. The Sport Imagery Ability Questionnaire is a 15-question assessment on a Likert scale to determine a participant's experience utilizing mental imagery training. This allowed for understanding of the practitioner's ability to image, which is necessary for educating athletes to appropriately utilize mental imagery in rehabilitation. The Attitudes About Imagery survey was also on a Likert scale, designed to determine attitudes concerning the use of goal setting, mental imagery, positive self-talk, and controlling pain on rehabilitation outcomes. With permission from the author, I amended the original AAI to only include the 8 questions that pertain directly to mental imagery. The results of the current study demonstrated the need for improved imagery education for coaches and rehabilitation professionals that provide support and intervention for injured athletes. The primary findings resulting from the interviews revealed 4 themes: background in imagery, implication of injury, preparedness, and intervention education. And each theme addressed one or more of the research questions posed in the study and provided insight on the needs and abilities of the individuals providing care to injured athletes. The following are excerpts from the interview transcripts. Each interview participant was asked about certain aspects of mental imagery use personally or in their professional life with athletes, and though it varied, all 8 interview participants were familiar with mental imagery to some degree. When asked about their perception of mental imagery, all responses were positive, with responses such as, "I think if you use mental imagery prior to performing the training or competition, you give yourself a baseline of success prior to performing the task." And mental imagery for reducing anxiety prior to all events was a staple of my training. When asked about their recognition of psychological symptoms associated with injury, whether that be their own or with a client or athlete, some responses were that upon becoming injured, that they were in a dark or a bad place. Or with their clients, as soon as they get injuries or have pain, they just stop. And when asked about their comfort and preparedness in using mental imagery in rehab, they said about 50% that they don't know a lot of tools. All 8 individuals interviewed were familiar with mental imagery to some degree, yet only one was introduced to mental imagery through a coach. None across various educational programs had any formal coursework or education pertaining to psychological interventions, with the exception of one rehabilitation professional that had worked extensively with a mentor, and even then it wasn't a part of her formal education. Others interviewed had learned about mental imagery through self-education, and their responses were as follows. I've read several books on the subject and tried to implement mental imagery into training whenever I could. I read about it and implemented what I read. When asked if they had access to sports psychology professionals, either as an athlete or when working with clients or athletes, whether they had access in the program, none had ever worked with a sports psychology professional. And they noted that one worked for a club team and did not have access to this type of professional unless the athletes went by their own means to an outside source. Each interview participant was asked if they had used mental imagery in rehabilitation in the past, and some of the common responses were that they don't think that it occurred to them to use it for rehab, that they honestly hadn't even considered that as something that'd be a good thing to do. And the most concerning was that they needed some space and time that's probably not available inside of those settings. The training manual may be helpful in the creation of a script or recording that could alleviate the stress of not having time or space during busy practice sessions or seasons to adequately address psychological concern. Overall, every interview participant was in favor of having a research such as a training manual, and they noted that they think to have a reference manual would be a great idea, and even offer training to coaches and others. Maybe even a video for athletes or just a framework for a coach to follow. I think a particular team or organization developing independent protocols to be used internally would be beneficial. This data supported the findings from other research denoting the lack of formal education in mental imagery. The AAI data suggested the need for emphasis on imagery when conditions in sport were less than desirable. And the data from the Sport Imagery Ability Questionnaire suggested that participants struggled with using mental imagery for arousal control or following setbacks or difficulties in sport scenarios. There was a strong desire from interview participants to have more guidance in creating psychological intervention and imagery scripts. They requested a framework that could guide them in the development of mental imagery scripts for their athletes based on his or her unique needs and injury, and suggested that an in-person training, video, or continuing education course be developed based on the manual to allow for even greater training. The results of the thematic analysis of the data address the research questions posed by the study, and the findings of this research are significant to the field of sports psychology as it relates to psychological intervention in the rehabilitation of injured athletes. The research findings support the need for mental imagery training for individuals working with injured athletes in a rehabilitation setting, and participants in the study supported the idea of the creation of a mental imagery training manual that would provide a framework for the creation of unique imagery scripts personalized for the individual needs of the injured athlete. Injury is often an expected byproduct of participation in sport. Psychological symptoms of injury must be addressed to improve rehabilitation and return to sport outcomes. And this study adds to the body of scholarly research of mental imagery training in sport. Future examination of the formal coaching and rehabilitation professional education of psychological symptom recognition and intervention practices should be conducted to determine how best to improve psychological interventions in rehabilitation settings. This manual was developed as a guide to using mental imagery techniques and assessments with athletes. The manual was suggested as a form of instruction for coaches athletic trainers, and rehabilitation professionals to use mental imagery training to counter these psychological effects of injury in athletes. Assessments introduced in this manual, such as the Sport Imagery Ability Questionnaire and the Attitudes About Imagery Survey, were developed and validated to determine the perception of individuals as it relates to imagery ability and use. And the following are some components of the manual. It addresses what is mental imagery, also includes the findings from this study, mental imagery uses in sport, psychological impact of injury, mental imagery benefits for injured athletes, mental imagery strategies and rehabilitation, developing mental imagery scripts for athletes in rehabilitation and in preparation for return to sport, evaluating mental imagery skills and effectiveness, and also assessments. The implementation of the training manual for mental imagery use with injured athletes in rehabilitation settings was developed based on findings of this study, which could improve confidence levels of coaches and rehabilitation professionals providing these psychological interventions. This mental skills training manual could provide rehabilitation and return to sport outcomes for injured athletes by increasing the number of knowledgeable imagery intervention practitioners in sport rehabilitation settings. Are there any questions concerning the study or any of these findings?
Thank you so much, Dr. Hawkins. That
Thank you.
was very, very good. I do have, so everyone, if you have any questions of Dr. Hawkins, please feel free to put them in the chat. I will be the moderator for any of the questions that come through. I'm going to start with the first statement. This one came from Dr. Christine McMahon. She states, as an athletic trainer who spent 18 years working in a rehab clinic, mental imagery was never used. My formal education never included mental imagery. I never witnessed fellow rehab professionals use this technique either. This is a great research study and a gap that must be addressed in the curriculum. Thanks for sharing. Taffy, can you give Dr. McMahon a little background on your, where you come from pertaining to athletic training or pertaining to that area?
When I received my undergraduate and graduate degree in exercise science, we were all in the same department, exercise science, athletic training, and physical education. And in my undergrad and graduate education, as well as the other programs, it was never addressed. And I was seeing that as a possible missed opportunity, as I had been interested in working with people in sports rehab. It was becoming clear that some things were missing the mark when it came to all the possibilities for rehabbing these athletes and preparing them to return to their sport.
Okay, great.
So in my findings, there was very little information as far as accreditation, maybe one chapter in a book that would cover mental imagery, and that was only for athletic trainers and not for physical therapists.
Dr. Peggy Sundstrom has this question. What was the most surprising finding of your study?
The most surprising thing to me was, with my interviews and with the surveys, we had a wide demographic, and some were athletes that had only competed in like high school, but it also included one individual that had gone on to play professional baseball. And even across all these fields and all these different training programs and things, mental imagery was never addressed. So I found that to be very interesting, that so many people have kind of missed this little key that would help them in their performance, but also in return to sport following an injury.
Perfect. Dr. Margie Estival has this question. Are there different ways to deliver mental imagery skill counseling and also in group settings? Just a question she has.
Okay. I believe that it's better if it's personalized one-on-one, but it can be delivered in a variety of ways. They could work with a practitioner themselves, which may limit, there's only one of you and there may be a lot of individuals. And that was one of the problems with the coaches that they were seeing. There just wasn't time to be able to do those extra things. But if they had a script that was written specifically for them, it could be done as a recording or a video, something that they could use often on their own. but I believe initially that it should be tailored to the individual and also their needs and any injury that may have occurred.
Okay. Dr. Sundstrom has this to say, interesting. So it's not just training for coaches, but training for athletes as well. So how much training is necessary to be effective in coaching mental imagery?
I don't believe that it can be done just like a 30-minute session, though that would really help. It would be kind of an introduction. In the manual, when it was created, it can be used as a standalone manual if you're good at reading things and then implementing what you learn. But if you're someone that needs instruction, then I lean more toward if it were developed as a continuing education course, something that they could do, whether it be with APTA or at athletic training conferences, to where it's something like a breakout session that they can get a little hands-on. And just, it really depends on the individual and how they learn best.
Okay. Letitia Porter, I believe coming from New Jersey, if I'm not mistaken, has this question. Hi, Taffy. Will you provide an example of how imagery is used to help an athlete's injuries?
Sometimes it's just a mindset thing, and their problem is that they have a fear of becoming injured again. I know that back a couple of years ago, I had become injured, and that return, just that getting back in the gym, it took like 8 weeks. And anytime I'd feel a little pinch or a little tug in my shoulder that I'd worked so hard to rehab, it really had a negative effect on my mindset. So working with the individual to convince them, you have to convince your mind that you've done all this work, you've done the preparation, your body is going to be able to handle the load that you put on it. And maybe not initially back to 100%, but that's the goal. It's always the goal to return to their previous level of sport. So one way would be to find out what the fear is, or if they just can't imagine that particular body part has strengthened itself to the capacity that they'd be able to return. But for the most part, it's just their mindset and the fear of getting hurt again, or if it took them out of sport altogether.
Okay, thank you. I have a question.
Okay.
As the Doctor of Psychology program chair, and also someone who was a committee member on your study, obviously this is very powerful information, and having a handbook like this is going to make a huge difference in that field. Can you elaborate for the next couple of minutes on the applied doctoral project and how that impacted your completion of this program?
I had initially, I wasn't aware that the applied doctoral project was going to be an option until we went to NRES 2. So when I did my master's research, it was all kind of theoretical, and I'm more of a hands-on person. So the option to have something that can be applied, like put some wheels on it and it's ready to go, was really exciting for me. And now there's something that can go and be directly implemented and impact the field that I appreciate so much. So I thought it was great to have that option. The program and the setup wasn't really any different than what I was expecting, except for the way that kind of the chapters were done. So I found that it was comparable to what I was used to with my master's research, but different enough that I felt excited about the challenge.
Perfect. And I'd like to bring that up because it is obviously a different kind of study, but it is something that I believe students can use in, like you have done with coming up with a guide. And so, there's one last statement from Holly Orso. This is kind of amazing. Everyone agrees visual imagery has a positive impact, but there's no training for it, nor space or time to do it. And Dr. Jody Humerta said this: I love hearing how the ADP practical approach benefited you, and thanks for sharing your experience. Holly Orso also has this question, and we'll have to move along right after this. What is the most effective type of mental imagery?
the mental imagery that I believe, I've researched different types, and there's motivational and healing. And one of the things with healing imagery, I don't think it's been as, if any imagery is included in sport, that is the one that's the least utilized. But for the purpose of injury, it should be more emphasized. So maybe motivational is probably used more often, or sometimes people would lean more toward mastery, depending on what their goals are. But for the purpose of this, and with fear of re-injury, I think that healing imagery would be more effective with this particular demographic. Did that answer your question?
She has not responded yet, but we do have to move along. Dr. Hawkins, thank you so much for this very important, the results from this important study. And Holly said thanks for that, by the way, the person you just responded to. Next, in 10 minutes, we have another presentation. If you, obviously, Taffy has her information here if you want to reach out to her. Dr. Hawkins, thank you so much.
Thank you, Dr. Rice.
All right, we will see you all in 10 minutes. Take care.